Teresa Freed with Johnson County Government. It's our goal to stop the spread of COVID-19 in our community. We also want to make sure you have the latest information on our efforts. For data on how COVID-19 is impacting the county, visit our dashboard on jocogov.org.
Hi, I'm Elizabeth Holzschuh from the Johnson County Department of Health and Environment. I'm here to talk to you about contact tracing. Contact tracing from a public health department's perspective is a key part for our ability to control communicable diseases. Not just COVID-19, but other things like measles, tuberculosis, STDs. Contact tracing for all of these diseases may look a little different, but the process is essentially the same. We start with an interview with the individual who's infected. We ask them a lot of questions about their health, their symptoms, their pre-existing conditions, and then we start looking into where they could have contracted the disease. Once we have sort of looked into that piece, we then look to see who they could have passed the disease onto. So in the case of COVID-19, we're going to look to see who they could have been around for an extended period of time. That's really within 6 feet for 10 minutes or more. We're going to ask questions about whether or not they were masked, what kind of room they were in. Were they driving in a vehicle where that air is recirculated, and that gives them a higher likelihood of contracting coronavirus from their counterpart. And so once we identify this list of individuals that the infected individual could have transmitted it to, we're going to reach out to those people, and we have an entire team dedicated just to this. This group of individuals are highly trained and keep your confidentiality at the highest level. So when they talk to you, they're not going to tell anybody who you are or what your circumstances are, and in fact, they are not going to be able to even tell you who you were exposed to. And again, this is a key piece to be able to protect individuals who are infected with communicable diseases, and this is a key part of HIPAA, what protects your health information from others finding out. What we know about coronavirus is that one person can spread it to 2 additional individuals, and then those 2 individuals can spread it to 2 more, and on and on. Each one of these is what we call a transmission chain, because each individual can transmit it to more and more individuals. So what our goal is, and what we hope our community's goal is to stop these transmission chains. And the way we do that is through case investigation and contact tracing, by finding those individuals who have been exposed but have not yet started spreading the virus and asking them to stay home for 14 days so they don't go transmit it to somebody else that they work with, that they're friends with, one of their loved ones, because we don't know who they may go and infect somebody else with. And we need to stop this because at some point, people are getting infected who cannot survive this illness and may have severe outcomes or may transmit it to somebody such as a nursing home resident or somebody else who's high risk. So each one of us has a responsibility to have coronavirus stop with us.
For more information about COVID-19 in Johnson County, visit jocogov.org/coronavirus. You can also subscribe to a daily e-newsletter with the latest data and precautions being taken in the county and state.